Okay, this video is do cell phones cause atrial fibrillation? And you can see a lot of people put their cell phone in their front pocket. And certainly the vast majority of them don't have any obvious problem. However, it's been shown if a person chronically stores their cell phone in their front pocket, over decades, they have increased risk of breast cancer. It's been also shown if they store a cell phone, a man, in the front pocket, they have lowered sperm production and sperm function. It's been speculated that it might increase the risk of rectal cancer if a person routinely carries a cell phone in their back pocket. But the other concern is that a cell phone in the front pocket increases the risk of cardiac rhythm abnormalities. Certainly if a woman is largely endowed, that might increase the distance from the heart and have a protective effect. So I haven't seen the paper yet, but one might speculate that breast implants could lower the risk of atrial fibrillation in that manner. Okay, but there's a lot more things that cell phones do. They increase voltage-gated calcium channels. Here, we'll get to some of the papers and whatnot. I don't have all the papers in this article. I've presented them all in previous things. I don't have a lot of time to put them all, but there's papers on all this stuff. Okay, cell phone's a low-power microwave transmitter. It's been shown if you put it behind the knee for a little while, you'll get blood sludge, sludging on the red blood cells, sticking together of the red blood cells, meaning that it has a prothrombotic effect, which could add up over time. You don't want a prothrombotic effect with something sitting over your heart. What is atherosclerosis? A blood clot. What is a heart attack? A blood clot in the arteries of your heart. When a person holds a cell phone to their face and talks for prolonged amounts of time, that releases mercury from their dental amalgams if they have any. Cell phones have been shown, when held up to one's head while they're talking, to open up the blood-brain barrier. Cell phones placed over tissue culture of neurons, brain cells, and astrocytes have been shown to cause necrosis, apoptosis of those cells. I should say apoptosis of programmed cell death. Cell phones use in children has been associated with hyperactive behavior, holding a cell phone next to their head. Cell phone held next to the head has been shown to change the EEG, the brain electrical activity, and can increase the risk of seizure. Prolonged usage held next to the head in persons with epilepsy. Apple Company, here's the Apple Company alert. You can see the little Apple logo up there about potential interference with medical devices. They said people should be careful that should not have the cell phone in the front pocket. It can increase the risk of interfering with cardiac pacemakers or with cardiac defibrillators. Sometimes we'll call those AICDs, automatic implantable cardiac defibrillators. It's been shown to change the EKG, electrocardiogram, electrical reading of the heart, by changing the PR interval, the QRS interval, the QT interval, and the heart rate. And some claim that it can increase the risk of atrial fibrillation. The bottom line is, I wouldn't carry it in the front pocket of the shirt or the front pocket of the pants, especially in a man. Okay, hope that's helpful.